Thanks, Chair. Awesome. Just coming back to the PEAs, the private emergency accommodation, and I take your point that the mortality rates there are, that the numbers being accommodated in PEAs has significantly increased, has doubled. It's actually now accounting for 2/3 of the spend on emergency accommodation, okay? And and the numbers, as you say, mortality rate are actually creeping up, and once the population there is coming on a par, I do think we really need to be concerned about this, and it's an issue that we raised when we actually had Brendan Kenny in when we had that meeting from the DRHE a number of months ago, and we have a commitment to have a follow-on meeting with him. And we did insist that there would be wraparound supports provided, and we accept that that has been done. But I suppose, I think coming out of this meeting as well, there should be a strong recommendation for a phasing out of that, because that accommodation is substandard. It's absolutely not giving people the opportunity or the hope to move on with their lives. And I just think it's important that, along with the 5 recommendations you made, that we should include that. And I wonder, would you agree with that? And secondly, when you talk about the critical incident review, what I've understood from your replies is it's purely an operational decision now, that there is acceptance that this is a good initiative, it should be implemented. And I suppose we should add that as well, Chair, I think, to our follow-on to Brendan Kenny and to the DRHE. And I think that in terms of the trauma-informed response, I absolutely concur with you on that. But I think it actually has to start even before people get to Park 8th Street, or before people are engaging with the homeless services. I think we need that trauma-informed response to start at the Intrio offices, at the City Council offices, and I think we should, as a committee, write to the Minister for Social Welfare on that, and we should write to the chief executives of the local authorities around the country to ask them to build into their staff training and staff supports a trauma-informed training and response to people who are in crisis when they come looking for help, and who have suffered quite considerably before they even arrive at that point. And I suppose, in terms of the report that we've done, Austin, thank you for allowing us to include this. And I think it would be great, Chair, if Austin can be involved in the future workings. We as a committee have committed to have this homeless issues addressed, and at least on a 6-monthly basis. Your recommendations are very strong, and thank you for giving us your time.
Well, thank you very much, Mary. Just in terms of PEAs, I suppose rather than comment on, I know some very good PEAs, so rather than comment on whether it's PEAs or STAs, I think we need to ensure that there's a proper standard of care provided, and that includes wraparound services and health services. And that's the key element I'm recommending. And secondly is that housing first. We still need to focus on getting them out of homelessness, essentially. So that's what I would respond. Absolutely, we need to address that issue, and that the service need to be all on a par. You can't have one service less service than another. Absolutely agree on that. Absolutely agree on trauma-informed care. I give you a good example of this. This is a story I often tell. Where I had 2 clients who had been homeless for 5 years, addicted to several substances, who ended up in a casualty in hospital due to hypothermia, and the guy was actually losing consciousness. And as the doctor and nurse were cutting off his clothes, they turned to his partner and said, "This is disgusting, the condition you've got yourselves into," and made them feel so bad that when they left, they swore they wouldn't go back to hospital unless they were dying. Now, I don't blame that doctor, because that doctor was in a system where there is stigma. That's he's overworked, he's overstressed, so the stigma gets concentrated. Those 2 patients went to a different doctor in a mobile health unit run by Safety Net, which was staffed by a GP trainee, who got them to see a doctor, Clíona Cali, who referred them to us. Basically, they're off everything. They got off everything, and in fact, she is now qualified from one of the top universities in Ireland just in the last in this year. So it just shows you that a proper response of someone who understands what they've gone through can lead to a totally different path. And again, I don't blame that doctor, but we just need to train everybody who interact with people of trauma-informed care. And I agree with you, all those offices, social welfare, health services, etc. And also in schools as well, teach the teachers,
Thanks, Doctor. And our